most famous physical therapist on the internet.
Hi, folks. I'm Bob Short, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
And our opinion, of course, Bob.
Our opinion or opinion. Today we're going to talk about knee pain. Top 3 critical things you need to do now. Treatments and exercises. And this is an updated video. We did this before, but now we're older and wiser, so we're going to maybe add some things, or at least we're going to make it clearer.
We got better mics, and
yeah,
we're better looking now.
Yeah, I would like to think that.
Yeah.
Too. All right, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, we're always giving something away. Go to bobandbrad.com and go to the giveaway section, and you'll discover right now that the giveaway this week is the Stretch EZ. This is a great strap for stretching for plantar fasciitis, Achilles tendonitis, the calf, the hamstring,
you bet,
and some other muscles. You'll find it also on Facebook, Bob and Brad, because we always have it pinned to the top of the page. You want a short version of us, go to Twitter or Instagram. We just have a 60-second kind of synopsis of our everyday show.
Yes, for the impatient people.
So we're keeping our hands warm with our little device today, aren't we, Brad?
Yes, we are. That's a really nice worm. I just wanted to
get rid of that. Okay, let's get started, Brad.
Okay, so knee pain. Now, we're referring to some of this to people maybe have arthritis, and you get that pain that kind of comes and goes, and you get that flare up, and you need to calm that down.
Right.
But not just that, you may have knee pain that you may not think is from arthritis or from an injury, and you can try some of these as well.
Yep, they all will help.
Right.
Possibly will.
So regardless of the cause of the knee pain, the number one thing, we mentioned 3 critical things. The first one is to unload or take the weight off the knee.
Right.
Typically when you walk is when you put stress through the knee, it increases the pain. If that's the situation.
Yeah, we're trying to get it to calm down.
Right.
It's flared up. Let's get it calmed down. A lot of times that causes increased swelling.
Right.
So a simple device would be a cane.
Right.
Or a walking stick.
Exactly. So if it's the right knee that hurts, you're going to use the cane in the left hand.
Right.
Okay. Don't pay attention to that show that used to be on Dr. House.
Right. It gives you more of a normal gait pattern here.
Right.
Normal walking pattern.
I went through a whole course on how this unloads the opposite leg, particularly in the knee and the hip, and it really scientifically works, and we know in the clinic people really does well. So you're going to walk with that cane, get it adjusted right.
Yeah, the cane's a little high for you.
Yeah, it is. This handle should come right at the wrist when we're standing tall with the arm down. So use that cane, and it's not you're going to use it forever.
Right.
You're just going to use it until that knee settles down, and then you're going to put it back in the closet.
My wife had a huge flare up of knee pain, and she's like, at first, we got her a walking stick. She goes, I am not using that walking stick. I am not.
Yeah.
She ended up using it because it got so bad. Right. And then it calmed down.
Sure.
So, I mean, it'll humble you.
Right. And if it's really bad, crutches are a great way to unload.
Crutches are too,
they're a lot more cumbersome, but you'll use them if you need them, if you can't walk so you can get around. So the other thing is sometimes, and I find this more so in the senior population, is off-the-shelf brace. You don't have to get a custom one. You can just go to the pharmacy or online and pick one up. It's a sleeve brace, or sometimes the Velcro ones, but they're not really.
Or both.
Right.
That's what this is.
Exactly. But again, they may have some supports on the side. They
might have staves on the side.
Right.
And, we're not advocating one brace over the other. Just find one that fits well. And a lot of times it seems like it just gives a bit of help to people.
Right. Yeah. So if it works better, the person feels better. It may be a psychological thing.
Right.
But if you can walk, the pain is less, go ahead and do it. I'm not saying go get yourself a brace, but if you have one around or you want to try it, they're not too expensive. It may be worth it.
It may be worth a try. Yeah.
And then the other thing, if you got steps or uneven surfaces, typically that's going to increase the stress on the knee. It's going to hurt. Just avoid those if you can.
Hills too. I mean, this
hills.
This is the time to go out for walks up hills and on trails that are really steep and rocky.
So if you add steps, you have to get up at the house one step at a time.
Yeah.
And up with the good leg. Go down with the sore leg first, and that takes a lot of stress off. The next thing is check your range of motion of your knee. if you look at your knee and you're sitting down and you have a hard time getting your knee straight and it kind of locks up or just doesn't go, what we want to do is try and regain full range of motion. And you can compare one leg to the other. If this leg goes down and this leg, you can see it doesn't go as far. We want to increase that range of motion. And one thing you can do is while you're in a chair, take another stool like we have here, put your foot up there, and then we're going to just gently put some pressure on that knee to straighten it. Now, if you get sharp pain when you do this, you're not going to do it. It's not right. But if you can do gently pressure on and pressure off, and you notice it feels better, and I would say no more than 10 repetitions. By the time you get to 3 or 4 and it's starting to feel better and the range is getting better, then you're right on. You're going to do 10 of those, and you're going to do those throughout the day. And if you get good success with that every time, it feels better when you're done, the range is regained. You can do that every 1 to 2 hours, and within a couple of days, you'll probably have the range back, and your pain more than likely is going to go down with it.
Yeah, it's the lack of extension or lack of straightening could be subtle.
Right.
It's just slightly more than the other side.
Yep.
And yes, it really is important that you do it quite often,
Sure.
like 5 times a day or whatever. So.
And then check your range of motion into flexion, or in other words, bending the knee. This can be done laying down in bed, and you grab your knee and see if you can pull. Bob is going to give a little demonstration there.
Yeah, and I can compare it to this side. Maybe this one doesn't bend as much, and that's not uncommon to the one that's sore.
Right.
So we want to regain that motion too.
And so laying down, go ahead, Bob. Why don't you show them? Right in bed, you can do this getting up in the morning.
You can get a towel if you need to, or a sheet, and pull down like this and pressure on, pressure off, pressure on, pressure off. Yeah, because some of you can't reach that well.
Right.
This can give you a little more leverage like that. So same thing. You can do that throughout the day. I'm going to show a mobilization too, Brad. Do you mind?
Sure. Go ahead,
So
Bob.
this is a little more advanced now, but it has worked for a lot of patients of mine that were having quite a bit of pain and had lacked quite a bit of motion. So you're going to put the foot up on a chair. This is the one I'm having trouble getting the motion.
Sure.
I'm going to grab the lower bone here. The 2 bones there are actually down there, tib fib.
Yep.
And I'm going to turn them toward the other side, toward the opposite leg.
Right.
So I'm turning them like this, which would be counterclockwise, right?
From your perspective.
Yeah, from my perspective. Yep. So I'm going to turn, and then as I'm turning, I'm going to bend the knee. So,
obviously, you have to have pretty darn good balance. You're going to be a pretty mobile and fit person to do this.
But I'm turning the leg the entire time I'm bending it. So I'm keeping the pressure on the entire time.
And you're going to do this if you do it without the rotation and it hurts, and then you do it with the rotation and it feels better, then you know you're going to do it. If it feels worse, then it's a red flag. That exercise is not going to be done.
So if I'm going to do the left leg, now I'm going to turn it towards this leg. This would be clockwise. Now, from my perspective, I'm turning it. I'm kind of grabbing on the ridge of the bone here with my fingers.
Right there.
Turning, and I'm bending forward again here.
Right.
Again, really has worked wonders with some of my patients.
Sure. Again, only do it if it makes it feel better and you get more range of motion. If it you may not be doing it right, or there just might not be that your joint might be.
Yeah, we're not. It may not be conducive for your problem.
Right.
I mean, but it's not a no pain, no gain. If there's pain, you stop.
Right.
Yeah, we're never ones for increasing pain.
Right.
So.
Okay, and then the other one. And
number 3. So this is the third critical thing you need to do.
Well, I'm going back to number 2.
This
is a real simple one.
Yeah.
Just what a leg, huh?
My God.
Yeah, look at those socks. They wear work socks, actually. But anyways, look at your kneecap. Get your quadriceps to relax, and then you can see if your kneecap has its mobility right to left. And sometimes it's going to be a little tight, so you're going to work it back and forth and get it to move better. Or you can kind of grab it like this and work up and down with it. And it should be free both directions within a few centimeters.
If it is free, you don't really need to do this one.
Right.
This is great for people who have patellofemoral syndrome, and especially if they're tight, what we call globally, it works great for that.
So you're going to loosen up. It's, again, one of those things, as you move it around, it should feel better and loosen up with less pain. Otherwise, you're not going to do it.
All right, so that was not under number 2 yet. Regain full range of motion. Now
Right.
we're moving on to the last one, which is you want to strengthen the knee. The
Right.
stronger the muscles are around the knee joint, the more they can protect the
Right.
knee.
Now, this is one you really need to be careful with because if you're going to do some squats, it's going to strengthen your knee, but you need to do them gently because if you do deep squats, it's going to increase the problem.
Right.
So what we like to do is use the ball.
Sure.
And the two reasons why you do that, you control your motion, plus it takes some of the weight off of the knee. You want to demonstrate, Bob?
I can, sure.
I'm going to get that, Bob, with the booyah stick. There you go.
Wow, what a throw.
It's kind of fun.
So the big thing with this, is that you don't want to have the feet way back like this and the knees go way past the front of the foot if you're dropping a plumb line.
Yeah.
Brad, why don't you go ahead and show that?
Yep, there we go.
So I don't want to go like that. That's what's nice about the ball.
Mm-hmm.
You want to make sure you got shoes that grip well enough so that you don't go sliding like this.
Right.
So, but I can go down now and I can keep the knee behind the front of the foot real easily now.
And you're only going to go down if the knee starts to hurt. Don't go that far. They may be shallow squats.
Yeah, and that's my suggestion to most of you is probably start with shallow squats because you're not putting as much. You're not getting down to the point where you're really putting that much stress on the joint. Then
right.
You're just strengthening the muscles without really hurting the knee.
Right. And some of your body weight is being taken up by the ball, so it just inherently takes less stress on the knee for that fact alone.
Yep.
So
you didn't show the lower quads.
Oh, no, we're not done yet.
Oh,
Bob.
yeah, okay.
Yeah, the long arc quads.
Long arc quads.
Now, and this is just simply, I just tell my patients, do these kicks, because long arc quads doesn't make a lot of sense unless you're a therapist. Out like this and down and sitting on a chair. You want to make sure your foot goes at about a 90 and you kick it out straight, but don't put ankle weights on. And I say 10 to 15 of these kicks or long arc quads, and it's good for people if you have arthritis and you've been sitting for a while and then you're going to get up and walk.
Get it warmed up.
Yep, do about 10 kicks with each leg, and that's going to decrease that pain when you get up and walk.
The other thing, Brad, even when you bring it up once, bring it up like this, give it a little squeeze. I mean, the muscle should tighten.
Oh, right, right. So you make sure those
quads are kicking in.
Exactly.
So
yep, little feedback there by feeling it. And the last but not least, this is a good quad strengthening exercise that's not aggressive on the knee joint. Is simply lay down with the one leg up like this, straighten the knee out, and we call them straight leg raisers.
Nice to do right before you even get out of bed.
Yeah.
Get some strengthening in the morning.
And this one also, works that quad, or works a hip flexor, a little abdominal. It's a good general exercise. So about 10 of them is all you really need, and then do the other one and use good controlled motion. Don't flutter it around like you're swimming or something of that nature. Oh, Bob, I'm feeling better already.
All right, well, good, because it's hard to get around when your knees are bothering you. I mean, they really will cripple you up. Can I still say cripple?
I don't know. You're getting into a gray zone there, Bob.
Well, it's a verb. I'm not using it as a noun.
Oh, really?
So,
good.
So
the English majors will
get
after us if we did something like that wrong.
Right. All right. Thanks, everybody, for watching.